the structure of insulin, regulation of the insulin, what are the preparation of the insulins, and what are the specific point for the insulin preparations, means each insulin preparation. Okay, now we'll discuss the oral hypoglycemic agent, means oral hypoglycemic drugs, and where they are used. Okay, oral hypoglycemic drugs are the drugs that lowers blood glucose level and are effectively means are effective in orally. Okay, this drug, the chief drawback of insulin is it must be given by injection. Okay, so to nullify this drawback, these agents are used. Okay, so these agents are classified as a oral and parenteral. Okay, still now we means saw the insulin preparation and insulin. Okay, so now we'll move towards the oral. Okay, in that the oral drugs are classified in two main classes. First one is the release of insulin, means the drug which are enhance or increase the means release of insulin, and second one is the other mechanism, means the drugs which act through different mechanism, but the result is that they increase the level of insulin in the body. Okay, so in release insulin means the drug which increases the release of insulin. In that there are two types of drugs. First one is the sulfonylureas and second one is the maglitinide. Okay, sorry. In sulfonylureas, first generation and second generation. First generation drug includes chlorpropamide, tolbutamide. Second generation includes glipizide, glicazide, and glibenclamide. Okay, and in maglitinide, it includes repaglinide and nataglinide. Okay, and in other mechanism there are different types of drugs like bigonides, thiazolidines, alpha glycosidase inhibitors, D2 agonist, then DPP4 inhibitors, then SLG2 inhibitors. Okay, that we'll discuss in succeeding slide. Okay, so first one is the first class of the drug is the drug acting by releasing of insulin. Okay, so in that we saw that the main class of drugs are sulfonylureas and maglitinide. Okay, so these drugs are effective only if 30% or more the beta cells in the pancreas are available. Okay, means sometimes in diabetic patients what happen, the beta cell destruction has happened. Because of that the insulin level get lowered. Okay, but in some cases suppose that beta cells are having a more number. Okay, but there are different reasons for the decrease of insulin. So in that cases these drugs are used. Okay, the main mechanism of that insulin, these drugs inhibit the ATP sensitive K plus channel. Okay, so in that chemical regulation we saw that, okay, whenever the ATP release means whenever that ATP channel open, okay, open state, in that cases whatever the potassium channel present in the inside the cell, that goes down, means that flow outside the cell. Okay, but this drug act on that ATP sensitive potassium channel and they close it. Okay, so result is that the excess means the concentration of potassium channel inside the cell gets increased. And okay, so it means and the increased concentration of that potassium channel, it start the depolarization. Okay, and that leads to opening of calcium channel and thus entry of the calcium into beta cell and release of insulin from granules and decrease the blood glucose. Okay, so this is the mechanism of that drug. Okay, so whatever the chemical regulation we saw now, that mechanism means these drugs are act through that mechanism only. Okay, so the first class of drug is sulfonylureas. Okay, in case of sulfonylureas, second generation drugs are more potent than the first generation drugs. Okay, which include tolbutamide. Tolbutamide is short acting. Then chlorpropamide. Chlorpropamide is longest acting and it also causes dilutional hyponatremia. Okay, then glicazide has additional antiplatelet action. Okay, these are the drugs and their special point. Then second class of drug is the maglitinide. These drugs are used for the treatment of post prandial hyperglycemia due to their rapid onset and short duration of action. Okay, Glimepiride decreases the blood glucose at lowest dose among sulfonylureas. Meglitinide is another sulfonylureas approved in Japan. Okay, so these are the special point that you have to remember. Okay, and the main side effect amongst means these both classes shows that is the hypoglycemic episodes. Okay, so here the point that you have to remember is first one is the mechanism, how they will act, and in what cases, means the patient which having a more pancreatic cell. Okay, means the destruction of destruction of pancreas cells are less in such a patient. Okay, so in that patient these drugs are effective, and the mechanism of these drugs is they inhibit the ATP sensitive potassium channel, and because of that they cause the depolarization of the cells, and uh, uh, depolarization of the cells, and result of that they increases the release of insulin from the granules. Okay, and the different drugs are sulfonylureas and meglitinide. Okay, and in that you have to remember the special point for each drug, means which is the short acting, which is the longest acting, and which has the additional property that you have to remember. Along with that, you remember the a common side effect that showing that is the hypoglycemic episodes. Okay, the next class of drugs are drugs acting by other mechanism. Okay, in that includes biguanides. Okay, biguanides under the biguanides, metformin and fenformin. Okay, the main side effect associated with the metformin is lactic acidosis, and in case of fenformin is megaloblastic anemia. Okay, these drugs act by activating AMPK. AMPK means adenosine monophosphate activated protein kinase. Okay, and these drugs is also called as AMPK activator. Okay, it helps in decreasing the production, inhibit gluconeogenesis and glycogenolysis, and increases the utilization of glycolysis of tissue uptake of glucose. Means ये ड्रग क्या कर रहे हैं, जो AMPK चैनल है, AMPK चैनल बेसिकली it it is responsible to enhance the gluconeogenesis means glucose formation. Okay, the so AMPK channel responsible है glucose formation के लिए, but these drugs inhibiting this glucose formation channel, because already in our body glucose level is high, so decrease or to reduce that glucose level, these drugs inhibiting this channel, and on the other hand side they means they increases the glycolysis means breakdown of glucose. So whatever the glucose present in the body, that glucose means the level of that glucose it get decreased. Okay, so biguanides are the AMPK activator that you have to remember. So metformin is the only oral agent that has been demonstrated to reduce macrovascular events, okay, in type 2 diabetes mellitus, and the contraindication for that means biguanides is cardiac failure and chronic hypoxic lungs disease. Okay, so in that cases the drugs are not used. So the next class of drug is thiazolidones. Okay, in that rosiglitazone, pioglitazone, and siglitazone. Okay, so the special point is that these two drugs, means rosiglitazone and pioglitazone, are means the rosiglitazone increases the total LDH. Okay, increases total and LDH cholesterol as well. Okay, and HDL means HDL cholesterol. These are low density cholesterol and high density cholesterol. Okay, so but opposite to that, pioglitazone increase both, no doubt it increases the total as well as HDL cholesterol, but it does not affect the level of LDL. Okay, so that point you have to remember here. Then trioglitazone has a severe hepatotoxicity, because of that it withdrawn from the market. Okay, and these drugs act as an agonist for peroxisome proliferator activator receptor gamma. Okay, PPAR. These receptor having a major role. Okay, in means in case of insulin, and because these receptors are present high means present in a high means high quantity on pancreas cells only. Okay, this receptor is responsible for the transcription of adiponectin, fatty acid transport protein, insulin receptor substrate, and GLUT4 gene. Okay, then the next class of drug is alpha glycosidase inhibitors. Okay, so here for the different mechanism, in different mechanism, one drugs are acting by inhibiting the AMPK, second drugs are inhibiting the PPAR receptors, third drugs are inhibiting the glycosidase enzyme. That glycosidase enzymes are responsible for the conversion of carbohydrate, means जो complex carbohydrate है उनका simpler जो monomolecular carbohydrate है उनमें conversion के लिए means that conversion is catalyzed by the alpha glycosidase. So that conversion is inhibited by the carbose and maglitol. Okay, so these are the different mechanism through which the we are reducing the glucose level in the body. Okay, the main side effect of alpha glycosidase inhibitors are flatulence, means foul odor or foul smell. Okay, so next class is the new drugs for the diabetes mellitus. Okay, so to treat the diabetes mellitus, still now we saw the insulin preparation, different insulin preparation, then oral hypoglycemic agent. Why we are using oral hypoglycemic agent? Because whatever the insulin preparation we prepared, that we are administering either subcutaneous, intramuscular. Okay, so avoid this complication, or to avoid such a tricky means such a hazardous or such a, as compared to oral route, administering ESC route or some intramuscular route, these are not preferred. Okay, so to avoid that route, we developed the oral hypoglycemic agent. Okay, then in that we saw the different drugs which increases the insulin release, in that sulfonylureas and maglitinide. Then we saw the different drugs which has the other mechanism, but they increases the insulin release. Okay, or they lower the glucose level in the body, in that bigonides, then thiazolidones, then alpha glucosidase inhibitor. Okay, likewise there are some new drugs, okay, which are used to treat the diabetes mellitus. First one is the incretin. So oral glucose provokes 4 times higher insulin release than intravenous glucose. Okay, means जो ओरल ग्लूकोज हम देते हैं, जैसे कि फूड है, कार्बोहाइड्रेट है, सो थ्रू दैट जो ग्लूकोज जाता है वो 4 टाइम्स इंसुलिन रिलीज करता है than the intravenous glucose. Okay, but this is because of oral glucose release GLP-1. Okay, but in some cases that glucagon like peptide that amplifies the glucose induced insulin release. Okay, means ये जो ग्लूकागॉन है, ये यहाँ पे मतलब इन डायबिटीज मेलिटस हाउ इट इज यूज्ड. सो ये क्या करता है, जो ग्लूकोज इंड्यूस्ड इंसुलिन रिलीज है उसको प्रोवोक करता है और एम्पलीफाई करता है. ओके, सो अल्टीमेटली द इंसुलिन लेवल इन द पर्सन इज increased. Okay, so glucagon like peptide 1 has additional functions. Along with that insulin release, it suppresses the glucagon secretion, prevent isolate cell integrity and decrease apoptosis, and delays gastric emptying and resulting in the reduced appetite. Okay, these are the special point in case of integrin. Then along with that, means to enhance or to increases the rate, means to enhance the activity of integrin or glucagon glucose like receptor, there are 2 strategies. Okay, first one is we are using GLP-1 receptor agonist, and second one is the dipeptidyl peptidase 4 inhibitor. Okay, so because of that these 2 drugs increases the level of GLP-1. So this GLP-1 increases the release of insulin. Okay, so GLP-1 receptor agonists are exenatide and liraglutide. Okay, and these drugs are administered subcutaneously. Okay, and the second class of the drug is dipeptidyl peptidase 4. Okay, this enzyme is responsible for the breakdown of this GLP-1. Okay, so inhibit the metabolism or inhibit the breakdown of this GLP-1 by inhibiting the enzyme dipeptidyl peptidase 4, and the drugs which are used are sitagliptin, validagliptin, and saxagliptin. Okay, so these are the new drugs used for the diabetes mellitus. Okay, then next is the sodium glucose transporter. This is one another drugs which are used in the treatment of diabetes mellitus. Glucose is freely filtered across the glomerulus and is reabsorbed in the proximal tubule by sodium glucose co-transporter. Okay, and the drugs which are used are dapa, dapalizo, dapaliflozin, and canagliflozin. Okay, and act by inhibiting this transporter and cause a glucosuria in diabetics, means it's showing the glucose in the urine. Okay, the main adverse effect of these drugs are increase the incidence of urinary tract infection and higher rates of breast and bladder cancer. The urinary tract infection is because of high quantity of glucose in the urine. So these are the different classes of the drugs that are used for the treatment of the diabetes mellitus. Okay, hello, hello.
Yes, sir.
Yes, sir.
Yes, sir.
Yeah, so these are the different types of the drugs that are used. So still now we completed still from insulin, means we start with the insulin, then we discuss the means regulation for the insulin and how insulin is synthesized in the body, then different kinds of insulin preparation, then oral hypoglycemic agent which are used to treat the diabetes mellitus. Okay, and uh, uh, the specific point for each class of the drug. Okay, so still now do you have any doubt? Because now last part is remaining is the gonadal hormones. Okay, it will take around 30 or 35 minutes. So whatever the part we discussed still from the morning, in that you do have any doubts, means in case of growth hormone, thyroid hormone, or insulin hormone, or in negative feedback mechanism?
No, sir.
Okay, so shall we continue?
Yes, sir.
Okay, so now the means initially firstly we discuss the growth hormone, then thyroid hormone and insulin hormone. Now we'll move towards the gonadotropins and what are the different gonadal hormones present in the body. Okay, so gonadotropins, after puberty, two gonadotropins means sex hormones are secreted by the anterior pituitary in response to luteinizing hormones. Okay, so, and also known as gonadotropin releasing hormone. That luteinizing releasing hormone is also known as the gonadotropin releasing hormone. Okay, so the two gonadotropins are follicle stimulating hormones and luteinizing hormones. Okay, in both sex, means in male as well as in female, the follicular stimulating hormones stimulate the production of gametes, ova in female and spermatozoa in males. Okay, in female, luteinizing hormone and FSH are involved in the secretion of hormones, estrogen and progesterone during menstrual cycle. Okay, and in males, luteinizing hormones, also called intestinal cell stimulating hormones, these interstitial cells are responsible for the means stimulate the interstitial cells for the of the testis to secrete the hormone of testosterone. Okay, these cells are present in the testis of the male, and these are responsible for the secretion of testosterone. Okay, then the deficiency of gonadotropins can lead to anovulatory infertility in males and oligo oligospermia and infertility in males. So here the points that you have to remember is that what are the gonadotropins and the secondary hormones which are responsible for the release of gonadotropins. So there are two types of gonadotropin. First one is the follicle stimulating follicle stimulating hormone, and second one is the luteinizing hormone. Okay, these two types are gonadotropins, and then the luteinizing hormone releasing hormone or gonadotropin releasing hormone is the secondary hormone for these two hormones to release. Okay, So FSH is present in the both the male, means both the sexes, in female as well as in males, and the function of FSH is to promote or to produce the gametes. Okay, then in females, the LH and FH are involved in the secretion of estrogen and progesterone during menstrual cycle, and in male, LH act on interstitial cells. Okay, in the testis, and it promote the secretion of testosterone. Okay, and the deficiency of gonadotropins lead to anovulatory infertility in female, and oligospermia and infertility in males. Okay, the excessive secretion of these hormones is associated with the precocious puberty, endometriosis, prostatic carcinoma, fibroid, as well as PCOD. PCOD is nothing but the polycystic ovarian disease. Okay, so these are the complications occurred when these gonadotropins are in the excessive quantity. Okay, so the drugs or the preparation which are used to treat the such a conditions are either means gonadotropin analogs or gonadotropin releasing hormones, or the antagonist which are used to stop the excessive release of gonadotropins. Okay, so the gonadotropins are minotropins, which is the combination of follicular stimulating hormones and luteinizing hormone. Then ureofolotropin, which is also known as follicular stimulating hormone. Then human chorionic gonadotropins like luteinizing hormone. Okay, these are the gonadotropin, means they are function like a luteinizing hormone and follicular stimulating hormone. Then the gonadotropin releasing hormone is gonadorelin. Okay, that you remember. Then third one is the anti-gonadotropins. In that supraagonist and antagonist are there. Okay, agonists are used in case of if the the level of gonadotropins is less, and you have to increase that level. In that cases, agonists are used like buserelin, goserelin, laprorelin, and naferelin. Okay, and antagonists are used if the excessive quantities of, means already excessive quantity of gonadotropins is there. In that cases, antagonists are used, that are ganirelix and citrulelix. Okay, the special point regarding gonadorelin is synthetic. It is a synthetic gonadotropin releasing hormone. Okay, and used to differentiate between puberty and hypothalamic defect in patient with a hypogonadotropic hypogonadism. Okay, means ये जो गोनाडोरिलिन है, ये एक सिंथेटिक एनालॉग है. ओके, एंड द मेन यूज इज दैट ये डिफरेंशिएट करता है किसमें, प्यूबर्टी, सॉरी पिट्यूटरी एंड हाइपोथैलेमिक डिफेक्ट. ओके, सो मीन्स जो हाइपोगोनाडिज्म ऑकर हुआ है और जो हाइपोगोनाडिज्म कॉम्प्लिकेशन हुआ है वो किसकी वजह से है, मतलब आइदर पिट्यूटरी ग्लैंड की डिफेक्ट की वजह से है या हाइपोथैलेमस की डिफेक्ट से है, वो डिफरेंशिएट करने के लिए गोनाडोरेलिन यूज करते. ओके, so if LH level increases greater than 10 milli international unit, okay, per ml after administration of gonadorelin, okay, then it indicate that the puberty means pituitary is normal. means suppose ये ड्रग एडमिनिस्टर करने के बाद अगर LH का लेवल ग्रेटर देन द 10 मिली इंटरनेशनल यूनिट है, तो जो डिफेक्ट है, मतलब जो हाइपोगोनाडिज्म हुआ है, वो बिकॉज ऑफ हाइपोथैलेमस, नॉट बिकॉज ऑफ पिट्यूटरी ग्लैंड. ओके, सो दैट काइंड ऑफ टू means to determine the that defect, the gonadorelin is used. Okay, then next one is the neferelin and busarelin. Okay, these can be administered by the nasal route. Okay, intranasal. Then gonador means gonadotropin releasing hormones in that supraagonist stimulate the gonadotropin secretion when given in the pulsatile manner. Okay, pulsatile manner means after every 90 minutes. Okay, and it inhibit the release of or continued administration. Okay, it inhibit the release on continued the administration, means अगर हम अभी अदर ड्रग के जैसे अगर इसको कंटिन्यूअसली अगर एडमिट कर मतलब दे रहे हैं, तो वो जो गोनाडोट्रोपिन का रिलीज है वो इनहिबिट करता है, इसलिए उसको पल्साटाइल मैनर में देना है, मतलब आफ्टर एवरी 90 मिनट। ओके, देयरफॉर दिस एजेंट कैन बी यूज्ड इन द पल्साटाइल मैनर फॉर द ट्रीटमेंट ऑफ अनओव्युलेटरी इनफर्टिलिटी, hypogonadotropic hypogonadism, delayed puberty, and cryptorchidism. Okay, so to treat such a kind of complications, these drugs are administered in a pulsatile manner. Okay, so here gonadotropins are completed, means uh, luteinizing hormone and follicular stimulating hormone. In that, only remember that, so which hormone is excessive, means which hormone has role in which sex, means basically this FSH has a role in both the sexes. Okay, and in male and female, LH is responsible for different functions. Like in female, LH is responsible for the estrogen secretion, and in male, LH is responsible for the testosterone secretion. Okay, then you remember the what are the complications if deficiency is there and excessive is there. Okay, then what are the different gonadotropin analogs that are used to treat, and the different special points that are, means different point are there with respect to each analog that you have to remember. Okay, then the last one is the gonadal hormones. Okay, in that estrogen. Okay, so this is our today, means this is today's last hormone. After that, means testosterone, then uh, uterine stimulant are remaining, but these are as compared to this, these are simpler one, and in that you just remember the only classification. Okay, and while memorizing the classification, just go, means remember the each specification that I will give in the slide only. Okay, because sir told that to take a class up to 1 or 110, so I think in the afternoon session sir will take the class. So we'll discuss this estrogen hormone, and the other only two hormones are there that I will prepare and I will keep in the slide only. So you read from that one. I will means I will collect all the important point regarding to that uterine stimulant and all, that I will keep here only. Okay, so the gonadal hormones, estrogen, progesterone, and testosterone are the principal gonadal hormones. Okay, estrogen and progesterone are produced by ovaries. Testosterones are mainly formed by the testes. Okay, so estrogen. Uh, in that, estrogens are natural steroidal estrogen and a synthetic estrogen. Okay, the natural steroidal estrogens are estradiol, estrone, estriol. Okay, estradiol has a maximum potency and site of action is ovary, and estrone is main in menopausal female. मेनोपॉज फीमेल मीन्स जो जिनका जो मेंस्ट्रुअल साइकिल टर्मिनेट हुआ है, इन दैट इन सच अ पेशेंट, सॉरी इन सच अ फीमेल, द लेवल ऑफ द मेन gonadal hormone is estrone. Okay, and the site of action is fat cell. Okay, then the third natural estrogen is estradiol. Okay, this it has a minimum potency and the site of action is liver, and this hormone means estradiol is maximum, or the level of this hormone is maximum in case of pregnant women. Okay, so that you have to remember, means which hormone is has a maximum potency, means which form of the hormone has maximum potency and which form is maximum, means in a maximum quantity in which kind of females. Like in menopause female, estrone is in maximum, and in pregnant women, estradiol is in maximum state. Okay, so that you have to remember. Then synthetic estrogen. Okay, the synthetic estrogens are two types: steroidal estrogen and non-steroidal estrogens. Steroidal estrogen includes ethinyl estradiol, misantranol, tibolone, and quinestrol. Okay. Non-steroidal estrogens are diethylstilbestrol, hexasterol, dinesterol, chlorotranacin, and methylenistril. Okay, these are the different types of estrogens. Hello, hello.
Yes, sir.
Yeah, don't get bored, huh? Next 2 to 20 minutes. Okay, so
Yes.
once after completion means after completion of this class, once you go through this endocrine system, in that you just read a classification along with this ppt, no need to read any book, because whatever the point uh, regarding the exam or whatever the important point, that I completed here only. Okay, so
Okay, sir.
the major site of estrogen production in premenopausal female is ovary, whereas in postmenopausal female is प्रोड्यूस्ड पेरिफेरली बाय पेरिफेरल ऑर्गन. ओके, मीन्स जो मेनोपॉजल वुमन है इन उनमें जो एस्ट्रोजन है वो जो पेरिफेरल ऑर्गन्स है लाइक लिवर, किडनी एंड ब्रेन, इनमें सिंथेसाइज किया जाता है. और जो प्री मेनोपॉजल है, ओके, इन केस ऑफ सच अ वुमन, एस्ट्रोजन इज सिंथेसाइज्ड इन ओवरी. ओके, एस्ट्रोजन स्टिमुलेट सिंथेसिस ऑफ प्रोजेस्टेरॉन रिसेप्टर, whereas progesterone inhibits the synthesis of estrogen receptor. Okay, means जो estrogen stimulate the synthesis of progesterone receptors. Okay, but these progesterone inhibit the synthesis of estrogen receptor like counterwise. In case of insulin, we saw that glucagon increases the synthesis of insulin, but insulin inhibits the synthesis of glucagon, like that. The major use of estrogen is for the hormone replacement therapy in postmenopausal females. Okay, the basic need to learn the endocrine system is to treat the means hormone related disorder, and how we'll treat that by using the hormone replacement therapy, because whatever the complications we are facing are either due to the excessive secretion of hormones and either decrease less secretion of hormones. Okay, so to treat the complications related to the less secretion of hormone is by giving the hormone replacement therapy. Okay, but if the complications occur due to excessive secretion of hormones, in that cases we are antagonizing, or we are decreasing the level of that hormones. Okay, this is the basic and main strategies to treat the any kind of endocrine related disorder. Okay, so these are the anti-estrogens. In that there are three types: selective estrogen receptor modulator, estrogen receptor antagonist, and estrogen synthesis inhibitor. Okay, modulators are the drugs which are in some tissues they are act as an agonist, and in some tissues they are act as an antagonist. Okay, because of that property they are called as a modulator. Okay, so here see, agonistic action is beneficial in tissue like a bone, decreased resorption and blood, better lipid profile, whereas it's deleterious in endometrium, means antagonist. Okay, and breast, increased risk factor of carcinoma, and liver, predisposition to thrombolism. These are the effects, means these tamoxifene, raloxifene, and ormeloxicin are the estrogen receptor modulator, means in some tissues they act as a agonist and some tissues they act as a antagonist. The estrogen receptor antagonists are clomiphene and fulvestrant. Okay, and estrogen synthesis inhibitors are aromatase, or they are also known as the aromatase inhibitor. The main feature is that this aromatase is responsible for the synthesis of estrogen. Okay, so to stop the synthesis of estrogen, we inhibit this enzyme. Okay, in that there are two types of drugs: one are steroidal and another are non-steroidal. The steroidal are reversible and type 1 are exemestane and formistane. The non-steroidal are irreversible, in that anastrozole, lantrozole, and fadrozole. Okay, so the the beneficial effect means in case of tamoxifene are in bone, it decreases the bone resorption, decrease carcinoma, breast cancer, and increase HDL, high density lipid, and decrease low density lipid. These are the 3B beneficial in case of tamoxifen. Okay, that you remember. Then raloxifene and benzodiazepine are used for the osteoporosis, and major adverse effect is that it increases the predisposition and thrombolism. Okay, that we mentioned here only. Okay, so these are the anti-estrogen receptors, means anti-estrogen receptor drugs or anti-estrogen drugs. Okay, along with that, the estrogen receptor antagonists are clomiphene and fulvestrant. The specific point for the clomiphene is has estrogen antagonistic action in the hypothalamus and used for the treatment of anovulatory infertility. Okay, and fulvestrant is the first FDA approved drug or FDA approved agent in a new class of a drug that are called as a selective estrogen receptor down regulators. Okay, means they are means lowering the level of estrogen. So because of that, they are called it as a selective estrogen receptor down regulator. Okay, and the last one is the estrogen synthesis inhibitor. First one is the aromatase inhibitor, means or the androgen are converted to estrogen in the peripheral tissue of postmenopausal females with the help of an enzyme aromatase. Okay, that conversion is inhibited. Okay, so these are useful for the treatment of tamoxifen resistant breast carcinoma. So these are the different drugs for the estrogen and to treat the estrogen related complications. Okay, so here, hello.
Yes, sir.
So so one more is there, progestin. Shall we continue with it? It take another 10 minutes only. Okay, so
Yes, sir. Continue कर दो.
okay, thank you. Just a minute. So next gonadal hormone is the progestin. Progesterone is the most important progestin in a humans. It is primarily secreted by the corpus luteum, and synthetic progestin may be classified as of in the fourth generation. First one is the estrans, second one is the gonans, third generation, and the fourth generation. Okay, so the examples are for the first generation examples are norethindrone, norethindrel. Okay, and they have the properties. They are have means weak estrogenic, androgenic, and anabolic action. Okay, and potent anti-ovulatory properties. The second generation are also known as gonans. They are norgestrel and levonorgestrel. Okay, these are more potent than the first generation and have reduced the androgenic activity. Okay, and levonorgestrel is more potent than the norgestrel. Okay, amongst that, levonorgestrel is the more potent one. Okay, then third generation. In third generation, desogestrel, norgestimate, and gestodin. These are the three drugs which comes in the third generation. Okay, these are very potent, strong. They having the strong anti-ovulatory properties. Okay, and reduce the androgenic effect, and they decreases the risk of acne and hirsutism. Then the fourth generation are nomegestrol and dospirone. Okay, these drugs are weak anti-androgenic these drug having a weak anti-androgenic property. They having a less anti-ovulatory effect, and they are strong anti-estrogenic effect on endometrium. Okay, and do not cause adverse effect on lipid profile or glucose tolerance. Then dosiprenone possesses aldosterone receptor antagonistic activity. Uh, Suppose it possessing the aldosterone antagonistic effect, then what it will do? Mainly, aldosterone is responsible for the maintenance of water and salt balance. Okay, suppose in case of aldosterone has a means in case suppose aldosterone is in lower quantity, in that cases, or suppose aldosterone is in high quantity, okay, in that cases, to nullify the effect of aldosterone, okay, then this drug is used up, okay. And the major indication for the progesterone are for oral contraceptions and hormone replacement therapy, okay. Progestin are added to decrease the risk of endometrial and ovarian carcinoma. And the antiprogestin drugs are mifepristone, onapristone, and gestipristone. Okay, you just remember that these drugs, and the special point for these drugs are it has a glucocorticoid and androgen receptor blocking activity. It also used in the medical termination of pregnancy. It used for the treatment of Cushing syndrome, as well as a morning after pill and induction of abortion. These are the main effect of means main uses of the mifepristone. And onapristone is the pure progesterone antagonist in contrast to mifepristone. Okay, so these are the specific point related to the progesterone. Okay. So still now, since from the morning we completed what is meant by endocrine, what is meant by gland, what are different kinds of gland, what means what is the exact function of pituitary gland, then how many hormones are secreted by the pituitary glands, and how many uh, 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 different parts like anterior pituitary gland, posterior pituitary gland. Then we saw the negative feedback mechanism. Then we start with the growth hormone. In that we discuss the role of the growth hormone and different types of the drug for the growth hormone. Then we came across the thyroid hormone. In that we saw the different types of thyroid hormone. Then the storage mechanism for the thyroid hormone and how the drugs countering that mechanism to treat the disorder related to the hyperthyroidism. Then after a week we started the insulin, okay. In that we came across the discovery of the insulin, then structure of the insulin, what are the different chains present in the insulin, uh, and how many interchain or intrachain bonds are present in the insulin. Then we started with the insulin preparations and each specification for the means specific point for the each insulin preparation, okay. Then we started with the oral hypoglycemic agent which are used to treat the diabetes mellitus. In that the different mechanism means how the drugs are acting, like that some drugs are acting by really increasing the release of insulin, or some drugs are acting by decreasing the means sorry by increasing the metabolism of glucose, okay. And then we started the gonadal hormones. In that means we started the gonadotropins and gonadal hormones. In that we saw the estrogen and progestin, and the in case of estrogen we saw the different estrogen receptor modulator and anti-estrogen drugs. And lastly we saw the progestin and the different generation or the drugs we or the analogs which are used in case of progestin related complications, okay. So the today's part means the whatever for the part we means I designated for the today's class that I completed. So up in that if you have any question then ask. Hello.